While it seems progress has been made in breaking down the stigma surrounding mental health, the numbers aren't showing it in rural Wisconsin communities.
That is where suicide rates are still on the rise. McKenna Alexander has the details on who is most vulnerable and what is being done about this problem. McKenna?
State health officials are urgently working to up Wisconsin's suicide prevention efforts. That's after the most recent DHS report found the state's suicide rate jumped 40% from 2000 to 2017. Now, it's an issue that is especially impacting men in rural areas. Any rural Wisconsin man between the ages of 25 and 64 is most vulnerable to suicide. The data is clear, so why is the reason behind it so complex?
It's business, it's family, and then you have all those changing things in their businesses that make it really difficult.
Karen Andres coordinates the wellness program that's a part of Wisconsin's Farm Center, a state organization working to address mental health specifically in rural areas. And that doesn't just mean additional outreach programs or clinics. It means making sure those living in rural areas aren't just heard, but understood.
And they can be connected to a stress counselor who can help them and who understands rural problems and what it's like to be in a rural small town community.
Andres explains fluctuating markets, uncertain consumer demand, a lack of labor, and the pressure of oftentimes running a generational family business is what's causing such a heightened suicide risk among rural men.
Farmers are only 1% of our population in Wisconsin, but 2% of our suicide rate. So that's a big concern.
That concern is felt on the statewide level and is already being addressed. Just last month, SSM Health opened Wisconsin's first ever day stabilization unit. Based at its hospital in Fond du Lac County, it reaches vulnerable rural communities with a patient base in any direction up to 150 miles away. But returning to the fields doesn't mean a return to clear mental health.
In many cases, though they can't be admitted to a hospital, they face great uncertainties returning home without guidance and important resources set in place for them.
To continue offering assistance any time of day, the Wisconsin Farm Center also offers a 24/7 helpline, telecounseling, in-person counseling vouchers, and even an online farmer support group for people all across the state to connect with one another. It's a big push, and it's working. According to Andres, last year, counseling voucher utilization reached an all-time high alongside a major spike in calls to the 24/7 helpline. So it's clear there's a need, which is why the Farm Center's support is continuing to grow and adapt.
As we see trends or changes, we have a plan going out over the next year where we're talking about specific topics that we see of real concern.
So as those local and statewide leaders continue their work, there's still plenty of ways you can help reduce the rate of suicide. One thing we can all do is check in on others. If you or someone close to you is struggling with mental health, know that there are plenty of free and confidential resources available.